Your child has been diagnosed with asthma. You might be wondering, what is asthma and what can we do about it? This is a short video that describes what asthma is, what makes asthma worse, and how we treat asthma. Let's start by talking about what asthma is. In order to do so, we must first talk about what the normal lung does. Inside the lungs are tubes called airways or bronchial tubes. When we breathe in, air moves down the trachea or windpipe through the bronchial tubes. At the end of each airway are tiny sacs that fill up with air like balloons. Fresh air comes into our lungs each time we breathe in. This fresh air has oxygen in it. Oxygen has a special job of giving energy to all parts of our body so we can walk, talk, eat, and play. So what is asthma? Asthma is the most common chronic or long-term disease of children. It is caused by inflammation or swelling and irritation of the airways. People with asthma have sensitive or twitchy lungs. When something bothers their lungs, they have trouble breathing. When someone is having an asthma attack, it is harder to get air in and out because the tiny muscles around the airways pinch very tight. There's also a lot of swelling inside the airways, and more mucus is made inside the bronchial tubes. This makes it harder to breathe. So what does asthma feel like? It can feel like wheezing, or a whistling noise when you breathe, coughing, chest tightness, or feeling like something is squeezing or sitting on your chest, or shortness of breath. These symptoms can be relieved and controlled with medicines and from staying away from things that make your asthma worse. Next, let's talk about asthma triggers. A trigger is something that makes your asthma worse. A trigger can cause someone to sneeze, itch, cough, or wheeze. Triggers are everywhere, but they can be different from person to person. Sometimes your child might have a mild reaction to a trigger one time and a severe reaction to the same trigger another time. So what can trigger an asthma attack? Allergies can make asthma worse. Allergens affect the immune system and can cause an allergic reaction and asthma symptoms. For example, pollen, dust mites, mold, and animal hair and dander can all make asthma worse. Irritants can also make asthma worse. Irritants don't cause an allergic reaction, but can irritate the airways and cause asthma symptoms. For example, smoke, exercise, colds, changes in weather, and strong smells or perfumes can all cause asthma symptoms. Asthma triggers may cause a lot of squeezing, swelling, and twitching in the lungs. Children may feel like something is happening to their body, but they don't necessarily tell their parents or an adult how they are feeling. Some early signs of an asthma attack include coughing, feeling bad, watery eyes, sneezing, stuffy nose, feeling tired, tummy hurting, itchy or sore throat, or chest tightness. It is important to encourage your child to tell you or another adult when they aren't feeling well. So how do we treat asthma? We can use medicines to treat asthma. You will have an asthma action plan that will tell you what medicines to take and when to take them. You should think of this like a traffic stoplight. For example, green means go. You should keep doing what you are doing. You are in this part of the plan when breathing is easy. You're not having any coughing or wheezing. You're sleeping through the night. and you can play or do sports without any problems breathing. Yellow means slow down. You should follow your asthma action plan and call your doctor. You are in this part of the plan if you're having some coughing, mild wheezing, shortness of breath, chest tightness, or are coughing at night. Red means stop. You should call your doctor or 911. Some signs that your child is in the red zone include lips or fingernails turning blue, the child does not respond to you, the child's skin is sucked in around his or her neck or ribs, the child has trouble walking or talking due to shortness of breath, the child is breathing hard and fast, the child is having lots of coughing, his nose is opening wide or flaring, the child is hunched over, or asthma quick relief or rescue medicines are not helping. Your individual asthma action plan may appear slightly different from the one shown. It is important to follow your child's individual plan, which has been created specifically for your child. So why do we use asthma action plans? Asthma action plans help you manage your child's asthma. Everyone with asthma should have an asthma action plan. An asthma action plan tells you which medicines you should take and when you should take them based on your asthma symptoms. It should be kept in a very visible place, such as on the refrigerator. Your doctor will provide your child with an asthma action plan at each visit. So what medicines can we use to treat asthma? There are two types of asthma medicines, controller medicines and quick relief or rescue medicines. Controller medicines are medicines that prevent symptoms of asthma and should be taken every day even if you don't have symptoms. They work by reducing the swelling and mucus in the airways and prevent the tightening of muscles that make up the airways. Controller medicines do not relieve acute asthma symptoms. Some examples of controller medicines include Flovent, Symbicort, Advair, Asthmanex, and Singulair. The second type of asthma medicine is called a quick relief or rescue medicine. These medicines are used to treat acute asthma symptoms such as cough, wheezing, or shortness of breath. They work by relaxing the muscles in the airways so it is easier to breathe. These medicines should only be used when needed and not every day. Some examples are albuterol, Proventil, ProAir, Ventolin, and Xopenex. Asthma medicines come in different forms. Your doctor will decide which form is right for your child. For example, nebulizers are machines that deliver asthma medicines in a mist. They require tubing and a mask. Asthma medicines also come in the form of inhalers. Inhalers come in the form of a dry powder inhaler or a metered dose inhaler. If your child is using a metered dose inhaler, it is important that they use a spacer or holding chamber, which is a plastic tube that attaches to the inhaler and helps make sure the medicines are delivered to the lungs efficiently. The very best way to manage asthma is to try to prevent asthma symptoms before they begin. Avoiding or eliminating triggers or the things that make your asthma worse is very important. It is also important to use controller medicines every day or as instructed by your doctor. If asthma is well controlled, your child should not have asthma symptoms or need to use quick relief or rescue medicines like albuterol very often. Next, let's talk about the goals of asthma treatment. The goals of asthma treatment are to prevent symptoms when possible, act quickly if symptoms occur, and keep symptoms from getting worse. So what are the goals of asthma control? They include no difficulty breathing, wheezing, or chest tightness, normal activities including play, sports, exercise, and other school and daycare activities, No coughing? No waking up at night because of your asthma symptoms? No missed school days or activities? No missed time from work or other activities for parent or caregiver? No emergency doctor visits, emergency room visits, or hospital stays? And normal or near normal lung function. Communicating with your medical team is extremely important. Your child's medical team are experts in asthma. They have had experience treating hundreds of children with asthma. However, you know your own child best. You see your child every day, while your doctor sees your child far less often. You are also the one who must carry out the care that your doctor instructed, or said to do, and give all medicines as prescribed. You are also the one who will know if the medicines are working, or if there are any problems, like side effects. No treatment or prevention program can work unless it is carried out correctly. Thank you for taking the time to watch this video. We hope you found it helpful in explaining what asthma is, what can make your child's asthma worse, and how we treat asthma. Please talk to your doctor or nurse if you have any questions.